Hi, this is Dr. J from Cornerstone Health, here to talk to you about posture. Here we see my friend Dr. Kitty in a very bad posture. Let's begin. First, her feet, they should be flat on the floor. Now they're flat on the floor. And they should be about as far apart as the knees. If the knees want to be close together, put the feet together. If the knees want to be far apart, put the feet far apart. Hips should be level with the knees, as we can see right here. They are nice and level. Low back should be nice and neutral, not bent forward like that. That's very, very bad. Not too far back like that, just somewhere in the middle, right? Mid-back should be resting against the back of the chair. Well, she should probably get a pillow or something, just a proper middle back forward. Elbows close to her sides and reaching forward onto the desk. And shoulders, they should be stacked above the, not right there, but stacked above the hips like so. And elbows should be a little bit more underneath the shoulders, so if you can pull your way closer to you, ideally scoot the table closer to you. And ears should be stacked above the shoulders, not like that craning forward, but a little bit far back. And there we have some good posture that will get Dr. Katie through her workday.